Next up, everybody, I'm excited to introduce longtime board member, longtime participant in the National Cancer Prevention Workshop, Janie Heath from the University of Kentucky. Janie has been an incredible friend to Less Cancer. She's been a friend to communities across America, and I'll tell you why. She's now the Dean of Nursing at the University of Kentucky, but she has been heroic in my mind in getting out there in front to end things like cigarette smoking, vaping, e-cigarettes, all of that. She has been a leader in every sense of the word. I first met Janie when she was with the University of Virginia, and now at the University of Kentucky. She has a terrific panel. I want everybody to not miss one little drop of this because it's really good. So thrilled to have Janie. Welcome back.
So welcome, everyone. We're real thrilled to be a part of the National Cancer Prevention Day for the Less Cancer Foundation. I'm Janie Heath. I'm the Dean of Nursing at the University of Kentucky, and we're thrilled to be a part of this panel discussion about lung health during a pandemic. We have a lot of experts and a lot of great work that's going on in Kentucky, so we want to share that with everyone. So we have assembled our expert faculty and researchers and students that will be telling a little bit about their story, about why they're interested in this particular topic and some of the work that they're doing. But I want to start off by just letting everyone know that I've been in this area for probably over 40 years. I'm very passionate about tobacco control as an academic nurse leader, also as a researcher. My particular focus has to do with tobacco dependence treatment and workforce development so that providers have the latest and the greatest evidence to go out there and put some interventions in place to help treat individuals that are tobacco dependent. And then probably the driving force for my work is that it's personal. My mother died when I was 5. She was a 1-pack-a-day smoker. She died of a brain tumor. My father died when I was 35. He was a 2-pack-a-day smoker. He died of metastatic lung cancer. Of course, I was too young to have the tobacco conversation with my mom. And my dad, I never had the conversation. Even though I was a nurse, he was a colonel in the United States Army, and there were just certain things that we just didn't do, and that was one of them. But I made a commitment that I would dedicate my life to help others quit, help them find the resources they need, and not be afraid to have that tobacco conversation. So now I'd like to turn it over, and let's hear from our students first, and then we will hear from our faculty experts. So let's start off with Emma, and when you say your name, your program of study, and your research area.
Hello, my name is Emma Bilberry. I'm a senior at UK's College of Nursing. I will graduate in May 2021. I research with Dr. Kristen Ashford, and right now we are looking at the use of conventional cigarettes versus electronic nicotine devices among pregnant and expecting mothers. And that's really an area of interest for me because I'm interested in adolescent development and childhood health. So it's interesting to see how smoking during pregnancy can affect those two things.
Thank you, Emma. Hannah, let's hear about you.
Hi, everyone. My name is Hannah Jirak, and I'm also a senior nursing student at the UK's College of Nursing. And I'm also researching with Dr. Kristen Ashford of the Perinatal Research and Wellness Center here at UK. And my focus on research is on pregnancy and smoking cannabis and tobacco use during pregnancy and how that affects maternal outcomes such as stress and depression, as well as neonatal outcomes such as birth length and weight. And so I have interest in maternal and neonatal health, so learning the effects of smoking on both these populations was really interesting for me.
Thank you. Let me move down to Julia. Let's hear from you.
Hi guys, my name is Julia Estes. I'm a junior at UK. I'm a hashtag Icon in the Trend College facilitator, which is an e-cigarette and tobacco prevention and education group at the University of Kentucky. So I started in March because I just witnessed a lot of my friends and family start using e-cigarettes without knowing all of the information and all of the risks associated with those products. So I just wanted to be the person that could tell young people the information that they need to know to make informed decisions about their health.
Thank you, Julia. And I might have missed it. I'm going to ask you to talk just a little bit louder. What college are you from?
I'm in the College of Arts and Sciences at University of Kentucky.
And what's your major, Julia?
I'm majoring in political science.
Political science. Okay, great. Thank you so much. Camille, let's hear from you.
Hi, my name is Camille Wright. I'm also a junior at the University of Kentucky. I'm studying in integrated strategic communication and digital media and design. So that's in the College of Common Information and the College of Fine Arts. I became a hashtag I Can End the Trend college facilitator back in March, right before the craziness of COVID really started taking off. And I'm really interested in pursuing this career in e-cig prevention education because I've experienced firsthand myself the health consequences of using. I've seen my friends go through those consequences as they have kept using and have struggled with quitting and all of those problems. And I just want to be able to give youth the information so that they can make better informed decisions so that they can live healthier lives.
Thank you, Camille. Let's go now to Jarrod.
Hey everyone, my name is Jarrod and I'm in the UK College of Nursing. I'll be graduating this upcoming fall 2021 and I'm actually working with Dr. Zim O'Cauley. We're doing burnout and smoking cessation research. So along the lines of that burnout, we've done a few projects, but right now we're doing quit and win surveys just to create those and push those out.
And Jarrod, I'm going to ask you to pronounce your last name so everyone knows how to identify you.
Franchino.
Franchino. Great. Okay, Dillon, let's hear from you.
All right. Hi, everyone. My name is Dillon Lay, and I'm a first-year health promotion master's student in the College of Education. I'm a former I Can End the Trend college facilitator, and I am now an I Can End the Trend research assistant. I'm researching with Dr. Ickes in e-cigarette use among youth in Kentucky. So I'm really looking forward to continuing with tobacco and e-cigarette prevention in my community and across the state of Kentucky as we plan to reach more and more students over the next few years.
Thank you so much, Dillon. Sierrah, let's hear about you.
Hi, my name is Sierrah Miley, and I'm a recent graduate from the University of Kentucky in the College of Education with a degree in kinesiology. During my time as an undergrad, I was employed as a tobacco-free ambassador, and that's when I truly fell in love with making a difference in public health. So as a tobacco-free ambassador, I was witnessing the firsthand increase of e-cigarette users, and that's when I helped develop hashtag I Can End the Trend, which is a way to allow us to fight this e-cigarette epidemic. I was previously a hashtag I Can End the Trend college facilitator, and I am now the program coordinator of that program. And being program coordinator of a peer-to-peer prevention program, it's really just allowed me to open my eyes to how important public health is. And it really has opened this idea that it's really a fundamental right for individuals to receive education on products that put you at risk, such as tobacco and e-cigarettes.
Thank you, Sierrah. You're famous. Mercy. Okay, Dr. Ickes, let's hear about you.
Hi, everyone. So I'm an associate professor of health promotion, and I have a joint appointment in College of Nursing and College of Education here at University of Kentucky. First of all, I just want to say, wow, we have some amazing young people on this panel, and I'm really excited to hear what they have to say as we progress. So my current work focuses on how we can prevent youth and young adults from using any tobacco product, including e-cigarettes. One of the things that I learned when I moved moved to Kentucky about 10 years ago is that we really have a disproportionate burden of, tobacco-related diseases and premature death here in Kentucky. And so it was hard not to get passionate and to get fired up and to really want to do something about this issue. And because I'm so inspired working with youth and young adults, I quickly realized that our young people are still susceptible to tobacco use if they're not supported and empowered to make informed decisions. And so that's where a lot of my work is grounded. So we know that to change the epidemic, to change the trajectory, we have to have innovative strategies like peer-to-peer programs, media advocacy, engaging our youth in advocacy and policy. And so our I Can End the Trend program, which you're going to hear more about from these amazing facilitators, and our program coordinator, has reached almost 6,000 Kentucky youth since we initiated back in February of 2019. And we've quickly become a positive influence across our state. And I'm so excited about that because it shows that what we do can make a difference. And the more that we come together, really, we can see, change these outcomes that we've been trying to change in Kentucky and across the nation forever. So our panel, they're going to share their front line. They're seeing this in their friends and their siblings. And I'm excited to hear what they have to say about this issue.
Thank you, Dr. Ickes. And before we jump in with questioning our students, I'd like to ask you just to give some latest data that that's out there about cigarette use and vaping statistics.
Sure. So the landscape in this area is always changing, and it's something that we really have to keep up on. Through the help of education, policy reform, and prevention programs, we've seen a huge decrease in conventional cigarette use for both Kentucky and across the nation, especially among our young people. Unfortunately, these rates still tend to be higher among Kentuckians, and so we continue to push for evidence-based education and strong comprehensive policies. We also know that e-cigarettes are currently the most used tobacco product by young people, including middle school, high school, and college students. So the surge occurred a few years ago when pod-based devices like Juul came on the market, and they are much higher concentration of nicotine. They are easier to use, easier to conceal, and they are definitely designed as kind of that appeal factor. So given the health risks and so many unknowns about these products, many states stepped up prevention and treatment efforts to help combat the epidemic, including our efforts here in Kentucky. While we have seen, some improvements in the e-cigarette use over time, we still have some things that we have to work on. So I'm going to let Sierrah talk about some of the good news.
I was muted, but the good news is the most recent data from the National Youth Tobacco Survey indicates a decline in the past 30 days e-cigarette use. And that decline was from 28% of high school students using in 2019 to 20% of high school students using in 2020.
That's good to know. And it is encouraging, but I'm going to ask a couple of questions. So these questions are going to Dillon and Jarrod, and I want to hear, do those statistics surprise you for us to take a decrease like that? And why do you think that we've had a decrease like that over the past year? I was surprised. I thought it'd be, out the roof because of the pandemic. What are your thoughts? Let's start with you, Jarrod, and then Dillon.
I'm not really surprised by it. I think the rates have decreased because of the lack of accessibility, and then there's a change in accessibility. So all of these high schoolers, they'll get it from their friends, or they'll go ahead and buy it from a gas station or some store. But with the stores not open and then them not seeing their friends, it's kind of hard to get it. Does that make sense?
Thank you. Dillon, what are your observations and thoughts?
Yeah. So, when I first saw the numbers, I was a little surprised at how much it had declined, but I'm not surprised that it has decreased over the last year at all. The work that the advocates, like everyone sitting here today, that they've done is largely responsible for that decline. But not only that, but other peer leaders in middle schools and high schools across the country are responsible as well. So, we've certainly done a really great job of providing youth accurate information about these products. But, what these numbers tell me is that young people are taking the information that we're providing them and making informed decisions on their own to not use these products. And even better, maybe even encouraging their friends and others not to use these products as well. So this is kind of a prime example of what we want to see of, young people ending the trend of using e-cigarettes themselves. And it's definitely something to celebrate, and it's a huge win. But there's still a lot of work to do, and we definitely plan to go full speed ahead with that work.
Okay, now I'm not going to put any bets out there, but I'm going to put you and Jarrod on the spot. So for the 2021 National Youth Tobacco Survey, what do you think? Are we going to keep dipping down, or you think there'll be a spike or go back up? Jarrod, just what do you think?
I think it's going to keep dipping down. Like Dillon said, we've got great education going right now. And if we keep pushing and pushing, I think that number will just keep going down.
Okay. Dillon?
Yeah, I think it's going to go down as well. I think with everything going on this year, everyone is so health focused and almost kind of goal oriented. So I definitely think it'll continue dipping down as we go through the next year too. Okay.
Thank you. I know where to find you guys if something happens. So Dr. Ickes, I want to ask you or your thoughts. These statistics are very, very promising, but we also know that the products are still, emerging out there in new ways. That disruption of innovation continues. So what are you finding that is important to share about what's going on throughout the country so that our youth know that, this stuff is dangerous?
Yeah, and I love the optimism, and it's always great to see prevalence rates going down across the nation. We haven't really been able to delve into Kentucky statistics specifically, but we'll hopefully be able to see some of that data in the next 6 months or so. And while the statistics are promising and we are hoping that there's a downward trend, we know that still over 3 million youth and young people are using these products. And so we have our work cut out for us. One of the other things that I think has been remarkable just in the past year is the work of advocates, and to try to really get comprehensive policies that reduce the accessibility of these products, that reduce the use of flavors, to try to have more regulatory processes in place, because that really hasn't been in place over the past 5 to 7 years when these products have taken off. And Dean Heath, as you mentioned, there are always new and more potent products emerging. And so we have to keep our ear to the ground, and we have to know what young people are using, because sometimes as researchers, we're a year removed from knowing what's really happening in our schools or on our campuses. And we also have to keep in mind that the tobacco and e-cig industry, they're trying to convince our young people that these products are harmless, that they're fun, and that everyone is doing it. And so we have to try to correct those misperceptions. And that's part of the education. It's part of having conversations. One of the things that I think was really telling from some of the newer data that came out is that there was 1,000% increase in the use of disposable e-cigarettes among high school and current e-cigarette users. So the products are changing. They're using, products that can get around some of the policy loopholes that have been put into place. And those companies know that. And so they're always going to be coming up with something better, greater, more marketable. And so hopefully we can hear from some of our young people what they're seeing, because I'm really curious in terms of, what is intriguing the youth from initiating and how can we combat that?
Thank you. So I'd like to hear from Emma and Camille. And Emma, in particular, I'm interested because you're dealing with a very vulnerable population. And I just am curious, what are you seeing with those moms, especially moms that are already struggling with substance use disorders? Are you seeing that they're jacking up some of these products, doing some things with their Juul devices perhaps? What are your thoughts on this, Emma?
Yeah, so when talking with different mothers and just kind of hearing their feedback on why they use e-cigarettes and those kind of things, one of the biggest misconceptions that a lot of these women continue to have is that e-cigarettes are safer during pregnancy than conventional cigarettes. And what we're seeing through research is that there's really not a huge difference. So the risk of using conventional cigarettes during pregnancy and using e-cigarettes is essentially the same. But a lot of these women are hearing from their healthcare providers or their friends and their family that, it's safer to go ahead and use e-cigarettes when we're finding out that's just not the case. So I think, just continuing to educate and clearing up that misconception among women. And I think that's an issue among adolescents too. Just kind of clearing up that misconception can go a long way.
Thank you, Emma. And Camille, I bet you're all over it, in communication to get the facts out there. What are your thoughts on this subject?
Yeah, I've heard of a lot of different new emerging products as people are trying to, at least some of my friends, since they're trying to quit vaping, they're finding other nicotine products. And a product that's becoming really popular is Zyn. And
what's it called again, Camille?
Zyn, Z-Y-N.
Okay.
Tobacco-free, spit-free nicotine products. So it's kind of like, it seems like it's like dip where they chew it to like relieve some withdrawal feelings of not having nicotine. And it's exclusively sold in the US. And this product, it contains nicotine salts. And I did some more research on nicotine salts. And so nicotine salts, they apparently have a smoother taste, and they allow vapors to consume a higher nicotine concentration than they would in just a regular e-liquid, which makes it really difficult to then get off of that product because now you have an even higher nicotine dosage by using that. And I know that a lot of my friends are turning to that product instead because it's also cheaper than vapes and getting e-liquid and jewel pods and everything. So I'm very concerned to see, hopefully, like youth don't pick up on that product. I know a lot of college students are using them, but I hope that high schoolers and middle schoolers don't pick up on it because it's definitely very dangerous and just as addictive.
Okay, I want to see a show of hands. How many of y'all knew about this Zyn, Z-Y-N? I did not. So thank you for educating me. Now, what does it look like? Is it do they market it in cute little cans like they're known to do with smokeless tobacco?
Yeah, it's in a can. And when I first saw it, it literally looks like an Altoid can.
Okay.
It's just like gum.
Yep.
Yeah.
So, and thank you for bringing that up, Camille. These products actually came on the market a couple years ago, but they didn't really take off until some of these policies were put into place and they, fall under that loophole. And so, one of the things that's concerning is they still include the chemicals. They're still using different kinds of flavoring, including menthol flavoring. And so there are a lot of health risks, potential health risks that we now need to start researching these products.
Wow. So they look like little mints. So they're the smokeless danger. Here they come. Very easy to disguise. All right, ZYN, I'm on it. Okay, let's switch gears just a little bit. And Dr. Ickes, I'd like for you or Sierrah just to give us the latest science that's out there about COVID and lung health. What are we finding that's happening with those that have COVID?
Sierrah, I don't know if you want to speak to this. This is something that we started integrating into our presentations because it's the world that we're living in. And, youth and young people are asking these questions as well. And so I think that it's telling that we always have to be changing our message and we have to keep up with the times. And so Sierrah, I don't know if you want to share some of the newest research that's come out. We're still learning, obviously, right? So we can't say that we have long-term research on this issue because it's very recent. But luckily, we do have some amazing researchers that are focusing in on this area.
Yeah, And so, as Dr. Ickes was saying, we do continue to learn more about the health risks associated with using e-cigarettes, particularly with the association with COVID-19. So as you may know, as you are using a vape or a cigarette, you are taking your mask off to do that. So that does limit your exposure in that way. And so also, given our times, the increased susceptibility of COVID-19 is an increasing concern. And so we are always looking for the latest research. But what we do know is, according to a recent study from the Stanford School of Medicine, young people who vape are 5 times more likely to be diagnosed with COVID-19 compared to non-vapers. We also know that if you are a user of both conventional cigarettes and vape, you are 6.8 times more likely to be diagnosed with COVID-19 compared to those who do not use.
Whew, okay, I'm learning a lot here. Thank you so much. So, Julia and Hannah, why don't you share your thoughts about what you're seeing, or what do you think about today's environment in terms of all this PPE and stress that's going on? Where does that put us in terms of lung health? So, Julia, let's start with you if you don't mind.
Yeah, so COVID has impacted e-cigarette use among young people. And to understand that more, we need to look at what type of user the young person is. So the Rescue Agency recently found that experimental users, or these students that have used 100 times or less, they primarily use with their friends or in social gatherings, kind of just to blend in. They said their use has decreased because, as you guys know, we're not seeing people as much. People aren't hanging out with their friends as much. So they're not exposed to that pressure anymore. And that's a good thing. On the other hand, we have regular users who have used 100 times or more. And these users are more likely to be dependent on nicotine. So because of the stress of COVID, the stressors of being home, their use has increased. So to really understand how COVID is impacting young people with their vaping rates, we need to look at what kind of user they are.
Okay, now Julia, I'm gonna put you on the spot. Political science major, let's say that you're running for governor of Kentucky. What's the first thing you're going to do? What policy are you gonna put in place?
I would raise taxes on e-cigarettes because Kentucky has one of the lowest taxes on e-cigarettes. So that definitely has to do with how high our e-cigarette rates are, how low the taxes are. So I would raise taxes on e-cigarettes.
Okay, that's good. Hannah, let's hear about you and the work that you're doing with Dr. Ashford. What are you seeing take place during the pandemic with those moms?
So with moms, it's similar to what Emma said. I think there's a misperception, and they're led to believe that e-cigarette use is actually a better option than conventional cigarettes. And I think that misperception is what we need to target first, because through Emma's research and my research, we found that there actually isn't much of a difference in terms of, my research was on maternal stress and depression and birth outcomes. And there wasn't much of a difference between e-cigarette use and tobacco and cannabis use. So therefore, I think more research needs to be done in order to determine the actual effects on maternal stress and depression and how that affects pregnancy outcomes. But in terms of young people specifically, I think, as Julia said, it can kind of go both ways. With the COVID-19 pandemic, there's a lot of increased anxiety about job security and financial issues. You might even be anxious about your own family's health. And this could be a push to get somebody to start initiating e-cigarette use as sort of an outlet. And so this is something that we need to target. And then also the young people, like high schoolers and middle schoolers, I think from personal opinion, there's been a decrease because, they're not in an environment where the peer pressure is present. And I think peer pressure is something that is the biggest factor in our young population in starting e-cigarette use. And so therefore, by targeting our peer population and using peers in our health promotion activities, I think that's going to be key to changing the landscape of e-cigarette use among our youth.
Thank you, Hannah. So I'm going to switch gears a little bit more. Probably the most famous scientist today is Dr. Fauci. Would you all agree? And when he speaks, everybody listens. And in our world of tobacco control, when the Surgeon General speaks, we listen, because that has proven through the decades the most authoritative voice in terms of looking at mass quantities of research and going out making strong recommendations for tobacco control. So, Dr. Ickes, share with us some of the latest that's come out from the Surgeon General related to the youth and smoking, vaping, tobacco use.
Yeah, and so the Surgeon General came out with a report a couple of years ago, and it's interesting because so much research has come out since that report. But even still, at that point, he said, this is an epidemic that's facing our country, that's facing our youth and our young people, and it's going to take all of us to change that trajectory. And so I think that was telling. In his report, he really talks about some of the short-term effects that we already know based on the chemicals in these products, based on the high concentration of nicotine, and that we still have to do some research to figure out the long-term effects, but we know what's likely to come. And so, in terms of some of the key points that we try to talk about with youth and young people, we know that these products can cause interrupted brain development because our brains are developing until we're at least 25 years old. And so that creates challenges when we're thinking about learning, we're thinking about impulse control, our moods. And so those are things that really resonate with youth and young people. And then we also know that some of the e-liquids contain really dangerous and harmful chemicals. So sometimes we talk about, it seems like we're in this hamster wheel and we're hearing the same things that we heard for years and years about about conventional cigarettes and what dangerous chemicals they had in them. But it took us over 50 years of research for people to start listening to us and for people to start believing us. And so, we always say, why do we want to wait 50 years to say that these products are not harmless and that they're causing really serious side effects, both short-term and long-term, not just in adults using them, but in youth and young people. And I would love if Sierrah would talk a little bit about some of the concerns that we incorporate in our presentations related to the chemicals and maybe the aerosol, because I think those are some of the key things that our young people want to know.
Yes, of course. And I love this question too, because I think it's so important to not only teach our students what's in these products, but teach them how to also identify research that is credible. And so some of the things that we like to teach our students is both short-term and long-term, but primarily the short-term health consequences, because that's what resonates with them on a day-to-day basis. And so some of these are directly related to the chemicals within and the flavorings. And so some of the flavorings that are within those e-liquids, they have been considered carcinogens or cancer-causing. And so there are also flavorings that are linked to popcorn lung, such as diacetyl. We also know that there are acrolein, benzene, and formaldehyde within these products. And these are all chemicals that we like to just have people aware that that's what you may be inhaling and the risks associated with those specific chemicals. And then in addition to that, not only are you harming your own health by inhaling these products, but also the people around you. So when you're emitting the vapor, so some people have this misconception that when you emit the product that comes out of these e-cigarettes, it's known as water vapor. This is a huge misconception that we like to hit on and every single time we talk to somebody about these products. And this is called aerosol. And so just like secondhand smoke, secondhand aerosol is harmful to your health and the people around you.
Thank you, Sierrah. Now I'd like to hear Jarrod and Dillon's thoughts on this. I know, Jarrod, you're working with a very vulnerable population with Dr. O'Cauley, the mentally ill, as well as working with the nursing workforce that's just stressed to the max. So what are your thoughts? What are you seeing? What's your team doing to help counter some of the messaging that needs to go out there or that's out there?
Well, adding on to that, I think, so a couple weeks ago, Dr. Hahn spoke at the National Research Paper Day here at UK, and she said, quitting is the best thing you can do for your health. So adding on to that, if we tell our patients that quitting is the best thing you can do every single time that we see them, maybe it won't click the first time, but the 4th, 5th, maybe even the 20th time, it will finally click. So it's not smoking cessation, it's a marathon. It's not a sprint. So we just have to take it each and every encounter, outpatient and inpatient.
Thank you for saying that and for bringing that up. It was pretty impressive that Dr. Hahn, who really is the one that we credit for the work we've done here at the University of Kentucky, that has been modeled throughout the state and throughout the country as one of the first to be very serious about tobacco control on a campus, especially in Kentucky, belly of the beast. And for her to be the keynote at an acute and critical care conference, basically, and to put public health out there on the forefront and how it's all of us have that opportunity and responsibility. And I love that analogy. It's not, a sprint. We are in a marathon with this. So thank you for that. Dillon, what are you seeing and what are your thoughts about messaging?
Yeah, so, like Dr. Ickes and Sierrah said, during our presentations and lessons, we really like to reiterate to our students that research on e-cigarettes is coming out constantly, right? So, this means that we have more and more access to information regarding these devices right at our fingertips every day. And, unfortunately, some of this information isn't really always truthful or accurate. So, we have to do something about this. Like you said, we have to counter this in some way. So over the summer, our awesome facilitators implemented an activity into our lessons that compare subjective sources and objective sources. So we begin, this activity by kind of asking our students what the difference is between a subjective and objective source. And if they don't know, we gladly explain it to them, what these terms mean. So again, when we ask our students about this, we ask them to take a few minutes to find information related to e-cigarettes on the internet. And once they have these sources, we analyze as a group and decide whether their sources are objective or subjective. And to wrap this up, we show them an example of an objective and reliable source from the CDC. And then we show a subjective and unreliable tweet from an anonymous user that is providing kind of like false information with no sources at all attached to it. So the point of this exercise is just to kind of make sure the students know where and how to access credible and reliable information on the internet, social media, or even from things that they may see on the TV or on the news and so on.
That's great. Continuing on this line of giving examples of kind of the lived experience of what each of you are doing, I'd really like to hear some more from Camille and Emma about what specific examples, maybe within the past 6 months, past year, that you've been a part of to help our youth not initiate tobacco use or some of these crazy, dangerous products that are out there. Camille, why don't you go first?
Yeah. So #IKing on the Trend, we're doing a lot of different initiatives right now. We decided to start doing Remind messages. And so Remind is an instant messaging platform. So all of the students have to do when we do our presentations, they just have to sign up to receive those messages with a code. And then once they sign up, we're able to directly send them messages. We can send them pictures, quitting tips, information all the time, whenever. So that's been a really great way that we can constantly be in communication with students outside of giving those presentations to them. Another thing we're doing is we're doing a Train the Facilitators program. And so we created these training modules using Canvas, and it's just to ensure that people have general awareness about the topics and they're able to relay information to their friends, their family who are using. And when you do that program, you also get signed up with the Remind service too. So now you're doing the training modules and we're able to directly communicate with you through the Remind again and keep reinforcing that line of communication and keeping that open. We also just recently created a video with the FAAN movement, FAAN meaning full energy, no drugs. We were able to create a video.
Did you guys create that? I love all your acronyms.
We didn't create that acronym, but we did make a video for their app, which is going to be seen by a bunch of students. And that was a super fun project to work on. It's an animated video, super cute, love it. And basically that video, it's just like a 2-minute condensed version of what our presentation would be like if we were giving a presentation to a classroom. And so those are some initiatives that we've been working on that have been so much fun, and just trying to make sure that youth know that we are available to them with resources. If they ever have questions, they can reach us on social media, Remind. We have so many platforms that they always feel connected with us.
Thank you for that. And I would really love to see that video. If you could send that to me, that'd be great.
Of course.
So Emma, let's hear, your researcher, Dr. Ashford, is the queen of acronyms. So tell me what you guys have been up to.
So it's been really awesome to work with the Perinatal Research and Wellness Center at UK, just to kind of further that research, further that discussion about cigarette substance use, those kind of things during pregnancy and the perinatal period. And Hannah and I recently presented our research at UK Nursing Research Papers Day, which is really awesome. So I'm really passionate about education. And I think one of the biggest ways that we can kind of work towards improving the situation is just by continuing to disseminate information, disseminate evidence-based research, and then especially like working with nurses. It was really great to present at that event because it was, for nurses. So I think just continuing to educate healthcare professionals, such as nurses, about what we can do to help kind of stop the smoking, all of that kind of thing. I think that is a really important part of the movement.
Thank you. Now, Hannah and Julia, I'm going to twist it just a little bit, because there's a lot of Zoom fatigue going on and all this tech stuff and a different app and a different platform. Is there anything that you see that you guys are doing on your team, Hannah, that you think we need to go ahead and continue doing? Because I don't see our world changing in terms of virtual presence anytime soon. So how are you going to be able to reach those moms moving forward with the continuation of our pandemic until we get everybody vaccinated?
I think that telehealth is going to be super important during these current times, especially during preconception and perinatal appointments. And in those appointments, I think it's going to be extremely important to include smoking cessation education every single time. As Jarrod was saying, as long as you stay consistent and you're following up with your patients and you're doing it every time you meet with them, I think you can actually make a difference in the long run. And also including education on e-cigarette use instead of just focusing on cigarette use, including the e-cigarette use as well in that education, I think can expand the population that you're educating, especially with our moms.
Thank you. Now, I'm going to really blow it up here, Julia. You ready for it? Because you're political science, getting you ready for the governorship. So, do you think we should still charge the same amount for our services because we're not face-to-face and we're providing, as Hannah said, more and more virtually through telehealth? As the governor of Kentucky, or as a legislator, policymaker, would you be an advocate to keep pricing the same, or would you see that we needed to discount it or increase it for messaging and putting interventions in place?
Yeah, I'm all for decreasing healthcare costs, especially because those that are impacted by e-cigarette use are actually lower income people are disproportionately affected by e-cigarette use. So it's really important that we reach those people. And by keeping healthcare costs as low as we can, that would be a really effective way to do that.
Thank you so much. We could not have scripted this any better, could we have, Dr. Ickes? Fabulous job, you guys. I'm so proud of you and appreciate all that you're doing. Dr. Ickes, would you like to close with a message?
Sure. I just love hearing from all of you, and it kind of reinforces why we need to have youth and young people at the table when we're trying to create programs, when we're trying to advocate for policies. We need to hear what's going on. We need to hear from your perspective what will work. And we know that when we listen, we do make an impact. And so thank you all for sharing your insight, and keep fighting the good fight. And I know you will. And I'm just so proud of each and every one of you, and look forward to working with all of you in the future.
What's up, everyone? My name's Dillon Lay, and I'm an Icon in the Trend research assistant.
My name's Camille Wright, and I am a Icon in the Trend college facilitator.
Our goal is to empower younger generations to end the trend of e-cigarette use among their peers. So let's get started. Did you know that all vaping devices are electronic cigarettes, and they almost always contain nicotine? They have changed over time and continue to change to make e-cigarettes more appealing to people our age. So is this really an issue? In 2019, 1 in 3 high school students were using these products. This reinforces we need to step up to end this trend.
What do we know about e-cigarettes? They produce aerosol that is harmful to our health and the people around us when inhaled.
Just one pod-based e-cigarette has the nicotine equivalent of at least 20 cigarettes. Did you know it only takes 10 seconds for nicotine to reach the brain? Our brains don't fully develop until we're 25 years old, putting us at high risk for dependence.
So why are people our age using these products? Tobacco and e-cig companies use tactics like fun, fruity flavors, appealing marketing strategies, social media influencers, and try to make us think these products are harmless. In 2018, e-cigarette companies spent $110 million on advertisements. So how can we prevent people from using e-cigarettes?
Well, we have to support those who are already using e-cigarettes and prevent others from starting in the first place. Sharing youth-friendly quitting resources is a great way to show your support. We can also be a positive influencer in things we do. Social media is a great way to spread positivity and influence your followers to prevent the use of e-cigarettes.
We challenge you to post reasons why you do not use e-cigarettes on your social media. Don't forget to tag #IconEndTheTrend.